Private insurance companies across the country try to dissuade people from going to the emergency room. Most do it through high copays. Tonight, we show you what happens when there's no incentive for cheaper care and no education about those costs. And it's costing you millions of dollars. Here's our new investigative story, Medical Waste. No pulse. From gunshot wounds to heart attacks, when people fight for their lives, an emergency room can be their last chance for help.
It's clearly abuse.
But some Louisianians go to the ER for hangnails, blisters, warts, even sunburn.
This is outrageously expensive.
And these ER trips have a catch. You're paying for it.
When someone goes to an ER to have a wart removed or to talk about their insomnia, that takes taxpayer money away from low-income people who really need it.
State and federal money fund the Medicaid program. Our review of 1 year worth of Medicaid emergency room trips found tens of thousands of apparent non-emergency visits.
But it's all taxpayer money.
Medicaid recipients visited the ER for fussy infants, throat pain, postnasal drip, patients feigning illness, even routine health exams.
I mean, all of these things could be treated at about 1/5 of the cost at a private clinic. And that's just a fact.
In a best practice, those patients would be treated in a clinical setting, not an ER setting.
Because it's cheaper.
It's much cheaper.
Take a typical upper respiratory infection. Jefferson Parish Coroner Jerry Satanovich is also the chief medical officer of 13 area urgent cares. Satanovich says a physician in an office can treat that infection for $75 to $125. In an urgent care, the cost $100 to $150, and Satanovich says an ER cost could be between $600 and $1,000.
Significant difference.
Sure, absolutely. But the ER's got a lot of costs to be open 24 hours a day, fully staffed, 365 days a year.
A bill filed in this legislative session would add an $8 copay to any Medicaid recipient who visits the ER for a non-emergency.
If you don't have an emergency, you go to an ER, you're going to have to pay for part of that care. So we support measures that help individuals take responsibility for using ERs when it's not an emergency.
That bill has stalled in the legislature.
The poorest of the poor can't afford a copay. I think what we do is they get better access, then we educate them so that they can understand that the times that they have to go to the emergency room has to be an emergency.
According to the Legislative Fiscal Office, last year 131,000 Medicaid ER visits were for non-emergency services. What's unclear is the actual cost to taxpayers.
And until you put the message out and educate them, you're going to continually have that to happen.
According to state leaders, part of that education should include stopping some hospitals from enticing patients. Some have an app or a website that displays current ER wait times.
Listen, if you really have a true emergency, do you have time to look at an app and figure out who has the quickest wait time? No, you're going to go to the nearest facility and you're going to get triaged, and if you're really sick, you're going to get in quickly. So, there shouldn't be a reason for these apps.
At this time of budget tightening, where every dollar truly counts,
we have a scarce amount of resources.
We found one patient who went to the ER 120 times in 1 year.
We have chronic abusers.
Sometimes this patient went 3 times in 1 day. Most of the time, the reason, abdominal pain.
We need to establish a database so that emergency rooms talk to each other across the state so we can identify this relatively small universe of chronic abusers and try to manage their care better.
These are millions of taxpayer dollars spent on acne, sprains, coughs, and headaches that could instead go to people who really need the help for real-life emergencies that could mean the difference between life or death.
This is something both conservatives and liberals ought to agree to. When people abuse emergency rooms using taxpayer dollars, obviously it costs money and is an insult to every taxpayer in this state, but it also takes away resources from poor people who really, really need the help.
The State Department of Health and Hospitals says when Medicaid is expanded, they expect those ER numbers to go down. The Public Affairs Research Council says non-medical ER visits, while still a problem, have been reduced over the last 10 years.